This is Health Call Online, the place for extended versions of interviews you hear on our weekly radio broadcast, the Health Call Radio Hour, heard on more stations around the country now as we've syndicated across the country. I'm really interested in talking today to Dr. Jarrod Wiegman from Indiana Direct Primary Care for a unique view on what's happening with this new class of weight loss drugs, Wegovy, Mounjaro, and all those other kind of funny names. He is prescribing these medications for patients and has seen some changes in the way that they're being handled by the insurance company, and also a new study out saying that it may be very beneficial in preventing some cardiac events. So lots to talk about here, Dr. Jarrod Wiegman. Appreciate you being here with us. How many patients do you have on these meds?
So it's increasing. We probably have around 10 patients, so it's not a ton. But again, our business model and the way that Indiana Direct Primary Care works and direct primary care in general is we just don't have, a ton of patients that like a normal doctor's office would. We're still building the practice, so we're still on the smaller side. And my practice in general tends to trend toward people who are healthier because we have the gym associated with it. So the people that I have are, really interested in nutrition and fitness to start with. And so they don't often necessarily need that medication, at least right off. That may be something we will add later for some of the members. But, we've got a decent number on now, and we're seeing, some trends with it.
Oh, good. I'm eager to hear. So what type of results are these patients having? We keep hearing of 15, 20, a new medication coming soon from Eli Lilly claiming 26% weight loss is possible. What do your patients see?
So it's within the range percentage-wise. And what I'll tell you is, with any percent, you've got people that are above that and people that are below that. I have one patient who was on it for, about 4 or 5 weeks and lost no weight. Had all the decreased appetite, the nausea, the other things, and it seemed like, the recipe was there to lose weight, but the scale just didn't show it. And it wasn't one of those weight loss situations where, we're gaining muscle but losing fat. It literally was, just a flat line. But then I've also got people that have lost 20 or 30 pounds, that are above, what we would consider the average to be. So, that's where that average thing comes out. You're going to have people that soar above it and people that it just doesn't work for.
Yeah, and I think the same could be said about the side effects. You just mentioned some of them. I keep reading that side effects are very common in some patients, or very extreme in some patients, and yet others not at all. What are you seeing in the real world?
I see most of it as being pretty tolerable, to be honest. If you do it the way it's designed to do, I think a lot of the weight loss places out there are initially starting people on higher doses because that's where they're seeing the results for weight loss. But the problem with medications when you treat them that way and you get that ramp up time of the lower doses to begin with is, that side effect comes in hot and heavy. And when it comes in that way, it becomes not tolerable. And when you start off on these lower doses and gradually wean people up to it, they're gonna notice something likely, but it's gonna be much, much more tolerable. And, eventually, just like most medications, most people kind of get over that side effect profile.
So the titration, the ramp up period is over a period of weeks, and these medications are typically a weekly self-injection, correct?
Right. So that's the advantage of these. There's some newer ones, well, actually not newer. So there's some other older ones that are pill-based form and some newer ones that are coming out pill-based form that people are really excited about because then they're not doing an injection. But the problem with that is then it's a daily medicine. But these injections, they're typically once weekly. And, when we do that ramp-up process, we start at a very low dose, typically for anywhere from 2 to up to 4, maybe even 6 weeks, depending on how they do with it, and then gradually go up to a second dose and then finally to a third dose. Well, we're utilizing it for, at least when I utilize it, for pre-diabetes and weight loss, or diabetes and weight loss. We can go up to the higher doses. I think there are some places out there that go up to the highest dose just specifically for weight loss. And I think to me, that's an issue. I think then we run into problems with, low blood sugars and more side effects for not a tremendous gain in weight loss. But again, there's a lot of people out there doing it.
So where are you comfortable prescribing? What are the conditions that I'm going to need to have to report to you, or you're going to have to see in my blood that's going to make you comfortable recommending these drugs?
Right. So a couple different things with my practice. I want to see people that, have a true need for it from, a underlying health standpoint. So not just for weight loss. Yes, could weight loss in general be good for most people that are overweight? Yes, but I mean doing it the correct way with diet and nutrition and exercise and things like that is what I really want them to see and do first. Putting them on a medication for something that they can spend some effort for themselves, I think is not the correct way to do it. So where I'm really seeing this is, my pre-diabetic patients who are trying hard to get better. They've got maybe some underlying heart disease, they're overweight, or just the truly diabetic patients that have, heart disease or difficult to control diabetes, or, they just want to do and try something a little bit different to get them, over the hump to get their diabetes under control. What I really I think is unfortunate is that, we've got a lot of weight loss clinics out there that are just prescribing it for those people that want to lose 10 pounds to go to the beach. And when we do that, we don't know what the long-term side effects of these are for people who don't have these other health conditions. It's not really studied for that. We know there's weight loss associated with it, which is why it's been used. But, those people that are, want to lose 10 pounds to go to the beach, I think that's a poor use of a pretty expensive medication. And because of that, we're seeing the people that truly need it and the people that would really benefit from it not be able to get it or not be able to get it as easily.
And you told me that there's been a shift for some of your patients in how insurance is applying the brakes. They're really pulling back on how they are approving these meds.
Yeah, and I think in some respects, rightfully so. I've had initially when we first started prescribing these, they would just, pay for it, and there was no roadblocks at all. And now that we've seen this more used as a cosmetic medication for weight loss, we start to see roadblocks in these. And the problem is roadblocks are good in some respects to help control costs, but at the same time, they shouldn't be so restrictive that we're not being able to get them for the patients that truly need them. And that's what we're really seeing. We're seeing that pendulum swing completely the opposite way from where they were able to get it without any information before, and now even with information, we're still not able to get it for these members, and that's disappointing.
And the information you're talking about there is blood levels that indicate you're either pre-diabetic or having some other challenges.
Right. So pre-diabetes, high blood pressure, high cholesterol, obesity, heart disease, all those things that go along with being able to lose weight and control blood sugars. We are in the business, are supposed to be in the business of preventative care. So those are the people we really should be hitting hard with things like this, where studies show these medications make a difference.
But what's happened is you've had some patients now rejected the insurance companies, even though I know you don't take insurance, the patients doing that outside your practice, but they're being rejected now.
Correct. So what they do is they go through the prior authorization process, which they do with a lot of medications. And again, that's that sort of initial roadblock. But the problem with that then becomes the questions are so restrictive at this point that, those ones that are kind of in that early stages where we really can make that difference, they no longer qualify. It's really just for the people in the later stages of these disease processes, which of course it helps for them. That's great too. We want to be able to modify their trajectory as well. But modifying the trajectory of the people who are early on in these process, that's where I think we're really going to see the benefit. And that's where it's disappointing that they no longer can get these medications, through their insurance that they pay for.
Yeah, that's a frustration for everyone, I'm sure. So what about the alternatives? If I don't have insurance and these medications can be several $1,000s a month, it's helping me keep my glucose under control and helping me control weight and all those other positive health factors. What are my choices? What can I do?
So fortunately, we've got some other avenues that we can potentially look towards. There are some compounding pharmacies out there that are combining things like semaglutide, which is Wegovy or Ozempic, with other medications. So in the case of one of the ones that we use, they combine it with B12. And because they combine it with B12, it's considered a new drug, and so they're able to compound it. And they tend to do it for less. It doesn't come in the fancy pens and things like that you'll see with the companies. It comes in a vial, but they can get it directly shipped to their home. It's less expensive. It's not cheap, though. I mean, you're still looking at, $100 a month as opposed to, maybe $300, $400, $500 a month with, the traditional medication. But at least it's doable for some people. And I have a good portion of my membership is people that don't have or don't qualify or can't afford insurance. And so, this particular medication, if we can get them on it, get them to reduce those numbers. Again, our goal isn't that they're on this medication forever, especially in that diabetes area. Our goal is to get them to lose weight, get a healthier lifestyle, get those blood sugars down to a point where we can manage them in other ways.
So this compounded version, you said it doesn't have the typical pen injector. So am I drawing with the syringe and doing an intramuscular injection, or how am I administering that to myself?
Right. So we train the people that through our clinic how to, do the injections themselves. So we will have them come in the office and we'll kind of draw it up in the office. We'll do their first initial injections here, and then we'll continue to do that weekly until they feel comfortable doing it at home. It's honestly, it's pretty straightforward. It's pretty simple. A lot of them are diabetic anyway. They've been doing injections for a while. So it's not a truly new concept for them. Our pre-diabetic people, again, pretty smart people with a little bit of education. It's real easy to do.
And what about the side effects? Are they any different with the compounded version as opposed to the pharmaceutical version?
We're not really seeing that, or at least I'm not, and I haven't really heard anything from other places that are using the same compounding pharmacy. Again, we're a lot of times they compound it with something pretty innocuous. So you're talking about B12, which is a vitamin that a lot of people, get injections of monthly anyway. And, we really can't get too much B12. Anything in addition to that, we sort of, our kidneys clear from our system. So if anything, it adds a little bit to, their overall health.
Yeah, and a lot of people are, B12 deficient just by nature. So I guess maybe that's not a bad thing. So let's talk a little bit more about these side effects generally, though. You go and you read some stories online, and my gosh, it's terrifying. People are having projectile vomiting and diarrhea that will not quit. The stomach cramps so severe that they have to step away from these medications. Is there any way to tell if you're going to be one of those people or if you're going to have an easy ride?
It's really hard to know. Most of my patients have tolerated it pretty well. I've heard those stories as well, but we really need to look back at how that medication works. The whole goal of those particular medications is that they slow down the emptying of our stomach. And when you slow down the empty of your stomach, you oftentimes feel full faster, which means you eat less. And then they also, slow down the emptying of the stomach to the point where it slows down things to the bowel process in general. So when we see that, when the stomach's full or longer, people can feel nauseous. There's that buildup there that they wouldn't otherwise normally feel, especially if they overeat, because that food is sitting in there longer, it's stretching their stomach longer, and that stretch to the stomach is what's causing those sensations of illness. And so, it's difficult to know who's going to have those symptoms, but, the ones that are definitely going to have it are the ones that overeat despite that sort of feedback mechanism. And we've all been there. We've all had a dinner where you've gone out and you've just eaten too much and you knew you ate too much, but you were just going to finish it because that's the way it was. But you go home and you're miserable afterward. But that's what these people are feeling on a fairly regular basis with relatively normal amounts of food. They have to learn to eat less.
Yeah, and I guess that behavioral modification is one of the main challenges in weight loss anyway, right? So this kind of becomes a biological reinforcement for listening to what your body is telling you. Is there, what is the fear of gastric paralysis? Now, I've read a couple of complaints. A couple of people are actually filing lawsuits claiming that these medications has paralyzed their digestive tract. What's the science behind that?
So this is hard to understand for sure. I mean, the whole goal of the drug is to slow that down. So the true paralysis or, the stopping of that's a process that happens with late-term, uncontrolled diabetes anyway. So one of the complications of diabetes is something called gastroparesis, where the stomach doesn't empty very well. And so, but it becomes, to a point where it doesn't hardly empty at all. And those people have chronic nausea, chronic vomiting, chronic issues with then having nutrition. Because even though they may still be overweight, they're still not getting the nutrients in like they overall should, and their medicines as well. So, your medicines are absorbed in your GI tract, and if you're slowing that down and vomiting things up, obviously you're not absorbing the medicines like you should either, so that becomes a huge issue. I don't think we know for sure, what it looks like for somebody who's on Ozempic for 10 years. We don't have the data for that. What we do know is that the people that were on it short term, they seem to sustain the effects of weight loss. And I think that could be attributed mostly to the change in behavior. Because again, if they're eating less and they're changing that behavior and they do it for long enough, it becomes more part of their routine and part of their life. And so that sustained weight loss off Ozempic may be contributed to that. The question, though, and the concern that people have is, once that drug's taken away, is there still something acting on the GI tract long term that we don't fully understand yet?
Yeah. And I have read just actually some complaints of the opposite, that when they've gone off Wegovy, they rebound and actually go back and gain more weight than they originally carried. So you're not seeing any of that happen in your practice?
Not as of yet. So, but I will tell you, the history of weight loss medications, I mean, that tends to happen.
Right.
We'll see patients that, that are on the stimulants or, some of the appetite suppressants, and they don't change their behavior and they don't change their lifestyle. And so, off the medicine, they go directly back to the behavior that got them to where they were before. And if you don't change anything, nothing's going to change on the other side. These medications force people to change. And if they don't continue that process beyond the medication, if they don't change their behavior, odds are they're probably going to lose or gain weight again.
Yeah, and I know, as you said earlier, your practice is unusual. These are people who are, by choice, being more proactive about health. So I get it. It makes sense that, with your counseling and advice, they're going to listen and hopefully modify their lifestyle. I mean, that's the reason that I'm paying that $99 a month to be a member of your practice. I understand that. What do you see coming down the road? What do you think is going to be the next shoe to drop in all of this? The insurance companies are tightening things. I'm hearing that the compounding pharmacies are receiving warning letters about preparing this medication. What could be coming at us next?
I think that's exactly what you're going to see. Is we're going to see more the crackdown on some of these compounding pharmacies, and so there's going to be less options to get it out outside of the traditional methods. As you know, with most drugs, there's a certain period of time where they can't make generics, and so what we'll end up seeing is years go by before it's affordable for other people for whatever reason, whether that just be for weight loss or whether that be for these pre-diabetic conditions and things. It'll balance out somewhere. I don't know where that's going to be at this point, but we'll also see other new drugs. Weight loss is a huge industry, and so now that we've got this side effect of a diabetes drug, they'll be searching that pathway just specifically for weight loss options as well. So I think we'll see over time that there's going to be more and more things come out that are purely focused on weight loss, because it is a huge industry.
So is it fair to say you're excited by this? I mean, there is lots of positive potential for patients here.
There is. In some ways, I'm excited about it just because, America is getting more and more obese. And, with obesity comes the unhealthiness that goes along with that, the other health conditions that we'll see down the road. And so I'm fearful for what the next 20 or 30 years looks like. In our hospital systems and our healthcare systems for people in these obese categories. And so I look forward to anything to help them lose weight. Ultimately, again, my practice is based on nutrition and fitness and the basics of healthcare. And that's really what we need to get back to. We really need to, push in America and throughout the world, really, that, we need to take care of our bodies. This is something that's going to be, an epidemic if it's not already, with obesity and the other health conditions related to it. But, medicine is not a cure for this. People that come in to any doctor's office and ask for a pill to cure their problems, there's bigger problems there than that. And that's the education component that I love with my practice, because we sit down and talk about those things. And when you talk about Ozempic specifically, one of the reasons I feel like I'm more successful with it in this practice, I don't have the issues with side effects and other things that you talked about, the problems with it, is that we spend a good portion of education. They're not coming into a weight loss clinic getting injected and shoved out the door without any instructions. And so when those people do that, they get their injection, they go out the door, they eat normally like they were supposed to, then they feel sick and they're not losing weight. Then they're very frustrated, and that's where we hear these stories.
Wow. Well, I've certainly appreciated talking with you about this, hearing what's really happening out there on the streets in the real world behind the closed door and from behind your view of the stethoscope. So, Dr. Jarrod Wiegman, thank you very much. You can find Dr. Wiegman at IndianaDirectPrimaryCare.com in Fort Wayne, Indiana. Thanks, Jarrod.
Thanks. I appreciate it.